Hey everybody, and welcome to the Dr. Mom Show. I am so excited because here we are, season 2, episode 13. Whoop whoop! And I'm your host, Dr. D, mom of 3. I hope everybody is having a fantastic day, and even more so, I hope everybody has had a blessed Thanksgiving, Christmas, and a happy new year. That's right. We are now in 2021, and that is not the number 1. That is the word WON, because that's what a fantastic year this is going to be. So you guys remind yourself that this is not year 2021, but 2021 WON, because we are going to do great things this year. Whatever you did not get done in 2020, I am speaking into your life right now that you will get it done in 2021. So definitely keep your head up. I know 2020 was a challenge for a lot of us, including myself, but you know what? We just got to keep going because, as they say, the world continues to turn. So again, Happy New Year. Don't forget, if you have missed the first season of the Dr. Mom Show, definitely check that out so you can learn more about the show and more about the amazing topics that we cover here at the Dr. Mom Show. And then, of course, I always remind you that the Dr. Mom Show is a medical informational resource. It does not take the place of your physician or your child's physician. So definitely seek your family's diagnoses and treatment plans from your own physician or your child's physician. So we're going to hop right in it today, and I am so excited. If you listen or watch the show, you probably make so much fun of me because every show I'm like, I'm so excited today. And that's right, I am excited. But today is extra special because, of course, it is season 2, the launch of season 2. It is a new year, and I have an amazing guest to launch my new season. So without further ado, today I have Hollis McCollum, who is a prior immigration officer, a mentor, and an author of To Save a World. And she enjoys the arts, traveling, and being creative. So she's much artsy. I'm not very artsy. I do like scrapbooking, but I can't draw at all. So help me welcome Hollis. Woo! Hey, Hollis, thanks so much for joining today. I'm so excited.
Well, thanks for having me. I'm excited to be here. I'm ready. Let's talk.
Let's do it. So, Hollis, tell our audience a little bit more about yourself.
As you mentioned, I've had a couple different professions, but I am the daughter of a Navy officer. So I grew up in a lot of different places, and I loved it very much. I'm an extreme extrovert. Yes. And so I was always the kid who was like making new friends immediately, which was good for me personality-wise. I love to draw. I love to read. Obviously, I love to write. And I also, just love my family. I'm married with 2 cats, no kids, but 2 cats. I'm the youngest of 3 children, and half Italian, half Scottish. And both of my parents were first generation from Europe. So my mother's side from Italy and my dad's side from Scotland. So I was raised kind of European.
Yeah, and she's also traveled a lot. We'll talk a little bit more about all her adventures, but she's definitely well traveled, which when we spoke, I just thought was so much fun because I personally love learning about other cultures, tasting other food. I mean, I love food, so you got to eat other food. So I love it. Well, today, Hollis isn't only an author, and we'll talk more about her book later in the show. But especially today, she's a special guest because January is National Thyroid Awareness Month. And Hollis has been so kind to share her journey having a thyroid disorder. So today we are focusing on hypothyroidism, or also known as an underactive thyroid. And again, Hollis, she's just been awesome to share what she's gone through. And I'm so excited about that because it's always nice to have somebody who's gone through it because others can relate to it. Because like we say in medicine, everything's not textbook. You know, as a doctor, you learn things, you read things from a textbook, but we also learn that you have to keep in the back of your mind, every person or patient doesn't present like a textbook says. So we always have to keep our wheels turning to make sure we're not missing anything. So just to give you a little background about the thyroid is located in the lower part of your neck. So if you can feel your collarbone or your clavicle, it sits right here on the lower part of your neck. And it depends on how much, you know, some people, their necks are a little bigger. So if you have that extra, what we call adipose or fatty tissue there, it's a little harder to feel your neck. And if you've been to your doctor and have had any issues with your thyroid, or even during your regular checkups, your doctor may check your thyroid, and usually we ask you to swallow. And of course, nobody can swallow when we ask them to swallow, because you're like put on the spot to swallow. And essentially what we're doing is we're feeling to see if the thyroid is enlarged, if it's tender, if we feel any nodules when you swallow. So we are able to feel, and you could probably feel it if you have a thinner neck. And that doesn't mean it's enlarged. It's normal to feel it. It's when we feel that it's enlarged, or again, if you have any spots on there. Mm-hmm. So if you look it up, like if you Google the thyroid, you'll see it looks, we tell our patients, it looks like a butterfly, and it really does, because the middle part, it has two lobes, and then there's a middle part that's a lot smaller, again, just like a butterfly. So it really does have that shape. So again, you have the right and the left lobe. And just to give you an idea of how sensitive and how important the thyroid is one, it makes hormones that regulates a whole bunch of things in our bodies. And that's what makes the thyroid tricky, because patients can either present with either very specific symptoms, or they can present with very vague symptoms. An example of this is when I was in training and I did my family medicine rotation, the attending would say, he would always, in medicine, and when we call it pimp, that you get pimped. And it's that, not that you get pimped out, but that you get pimped because the doctor who's teaching you just asks you a load of questions, and it's like back to back. So you better be like on your P's and Q's when they're asking you. So he would always ask, okay, a patient presents with X, Y, and Z. What do you want to check first? And essentially what he was trying to teach us is that no matter what a patient presents with, always check the thyroid, because that's how much it does and how just different people can present with thyroid issues. So again, as I mentioned today, we're focusing solely on hypothyroidism, where your thyroid is underactive, so it's not making enough hormones to regulate some parts of your body. And just so you know, just in passing, there is hyperthyroidism, is when your body is hyperactive. So maybe in another show we'll tackle that, but today we're really talking about hypothyroidism. So Hollis, you were diagnosed with hypothyroidism in 2012. Tell us about that and what kind of symptoms you had and what prompted you to go to the doctor.
So I actually have other conditions, which I was already going to a doctor. I am one of those people, like my doctors have literally written studies on me. So I have endometriosis and a bunch of other reproductive gynecological issues. And so I already had hormonal. And I was going to my gyno about it because I was suddenly feeling so much more dizzy, and my hot flashes were increasing and all of that. Because, you know, hot flashes are not just for young women, by the way, or older menopausal women, by the way. Like if you're hormonal, like, you can get through your 20. And so yeah, I was increased hot flashes and super dizzy. I was ridiculously tired. I was like so ridiculously tired in a way that it was like, it's not overwork, it's not lack of sleep. I am like, this is medically wrong. Like, this is not okay. I know myself. I know I'm sleeping, not okay. And so I went to my gyno because he's the person who I went to first, and he actually did test me for T4 thyroid. And he, you know, ran, and that came back negative, and he ran all these other tests, and he just said, you know, I can't figure it out. And I love him because he's been my doctor for over 20 years. He and I are actually really good friends. And he recommended me to a friend of his, an endocrinologist, who said, he didn't know it was a thyroid thing, but he just said, this guy's the best. Whenever I'm stumped, I send my patients to this guy, and he always figures it out. So I'm sending you to him. And so I went, and he tested me for the gamut, for everything, and came back T3 thyroid, and a very extreme case of it. Actually, he literally said, "This is the worst I've ever seen."
Oh, good.
Yay! And I also had, some other issues that came with it, like my adrenal gland doesn't function properly. I was B12 deficient, D3 deficient, like many deficients, and all of that. But a lot of that was because of my thyroid. And so he immediately got me on this it wasn't Synthroid, because of my other problems and sensitivities, I don't do well with synthetic medications. So I often have reactions to them, not necessarily allergic, but not good reactions. So I was put on an organic T3 thyroid supplement, and it had it was like CMP T3 something. I don't know. There were a lot of numbers and letters. and it was about I think 50 milligrams of that, and I did it every morning. And as soon as I started to take it every day, and I'm very good. I'm a very good girl when it comes to taking my meds. So my mother is a nurse and all that as well. Yeah. So I know not to be that bad, and I always take my medicine. So I was doing, and honestly, I improved tenfold. I suddenly, and I'd also had weight gain as well, which super fun.
Nobody wants that. I mean, especially as women. I mean, none of us want to gain weight.
No, and I gained for me, and I've lost it since then but it took me years, because I gained it, and as you'll probably discuss, when you have hypothyroidism, gaining weight's a lot easier, and keeping the weight off is so much harder, even once you lose it. So I had gained about 10 or 15 pounds without even changing anything about myself.
Without trying.
Yeah. Without eating crap. And, I exercise 5 to 7 days a week. I'm a very active, generally healthy eating person, but, yeah.
Well, awesome. And I just want to hit on a couple things that Liz talked about. So one, as far as the thyroid being underactive, she had some symptoms that were textbook. So again, just feeling tired, because essentially what happens is your body slows down. So everything slows down. So you feel tired, your metabolism starts slowing down. So people can gain weight. And just to throw it out there with the thyroid, because I know people come in all the time and they're like, I can't lose weight. It must be my thyroid. Can I get my thyroid checked? So we want to be realistic here. So the thyroid itself, usually the average is about 15 to 20 pounds that we can really, say that's my thyroid. So if you're 100 pounds over what your goal weight is, we need to look at something else. Not saying that it's not the thyroid, because we still check it if people are having a hard time losing weight. But realistically, it's about 20 pounds or so that the thyroid can cause, not 40 or 60 pounds for people to gain without, like Hollis talked about, trying. Right. People can have a change in their hair. So a lot of times their hair can become coarse. She's like, that was me.
Mm-hmm. Yeah. I get little bald patches in my eyebrows.
Yes.
And, not right now, but right here, because I take my supplements, I get I'll get a bald spot right here.
Yeah, so people can start losing weight. And again, how I talked about textbook, we can also even see something like that in hyperthyroidism. So again, that's why it's so important that we check all these things. Women can get irregular periods. There can be a change in people's voices. Usually with hypothyroidism, again, where it's underactive, people are usually cold when other people are warm. Whereas when it's hyperactive, people are hot because things are going like fast, super fast. So people can have that colon tolerance. So, and then some people can even have, we've had people present where they're a little confused and it's their thyroid. People start forgetting things and it's really their thyroid. And I just wanted to touch a bit about the lab. So we were talking about this before. So when you do get your thyroid checked, so there's two main hormones that we look at that the thyroid makes. So it makes T4 and T3. Those are the two. And then there's something called TSH, which is the thyroid stimulating hormone. And that doesn't come from the thyroid itself. That comes from our brain. It comes from what we call a pituitary gland. And what, Hollis talked about the endocrinologists, what they do is they really look at all these hormones, and how our hormones are triggered and how they function is all dictated by our brain. So when women get their menstrual cycles and things like that, it's not all of a sudden you're like ovaries and stuff are doing their own thing. Everything's dictated and triggered by the brain. And we call this a negative feedback loop because it's a total opposite. So what happens is, in hypothyroidism, when the thyroid again is low and underactive, the stimulating hormone in our brain ends up going up because it's telling our body, hey, you're not making enough thyroid. We got to go. Come on, catch up, get with the program. So normally what we see, and of course there's always, exceptions to this, but normally what we see in hypothyroidism is that we see the TSH is up and the T3 or the T4, or it could even be both the T3 and the T4 are low. So like in Hollis's case, she mentioned that her T4 was normal, but her T3 was low. So that's why it's important that, whenever you get checked out, just make sure that it's the whole panel. And again, this is one reason I do the Dr. Mom Show, so you guys are more informed, so you can have a conversation with your doctor. And it's not that you're telling them what to do, you're just more knowledgeable about what's happening. Because I love it when my patients understand their disease process, because then they understand why I'm doing, what we're treating, what's our goal. And I think people are just more compliant with their medication and with the lifestyle changes that we talk about. So back to Hollis. So Hollis, before all of this, like, is there any family history? Anybody in your family who has any thyroid issues, or you were just like picked?
Well, at first I thought I was just chosen. But one of the things that, yes, I'm so lucky. But one of the things that happened is, and I come from a family of highly tolerant people, meaning that we, it's not that we dislike going to the doctor. We have medical professionals in the family. That's not it. It's just that we have high tolerance for being uncomfortable and being in pain. And I mean, I had a broken toe for 2 weeks once, and I just didn't even, I was like, screw it. And
like I'm running a marathon.
Yeah, no, I was walking on it and everything. And then I looked at it one day and I was like, that's why that toe has been sore. And I clicked the bone back into place and taped it up, and I was done.
Oh. This is like survival in the wilderness stories here.
I have, one of my conditions is chronic pain. So I literally have just this obscene tolerance for pain. So it took me a while to get tested, number one, to be uncomfortable enough and tired enough to
you're like crawling into the doctor's office.
Yeah, no, and my doctor, my doctors, I have two that I see regularly. They both just are like, that they'll sit there and they'll be like, okay, explain your symptoms factually to us. Don't do it emotionally. Tell us, like, how it, and so that they can get a better gauge on how bad it is. Because if I just say if I'm like, give them a scale of 1 to 10, they're going to be like, she's going to say a 3, but it's an 8. And we can't do that. So, my dad actually, though. So after I got diagnosed with thyroidism, because my dad is like me, highly tolerant and all of that. And just, I can tolerate this, move on with life kind of attitude that we tend to have. After I got diagnosed, my mom, her little nurse sense went, you know what? a lot of those symptoms that my daughter has, who just got diagnosed with thyroid, my husband has. And she took him straight into an endocrinologist, and the endocrinologist looked at him because he has one eyebrow that's shorter than the other. And he said, and he looked at him and he goes, "You've got a thyroid issue, don't you? Stick out your tongue." And because apparently there's rippling on the sides of the tongue. Yeah, which I have too, and everything. And the doctor was, did like a 2-minute visual assessment and was like, I mean, I'm going to run all the tests. I am 90% sure that this is thyroid. So my dad had been suffering with it for years, and his numbers weren't as bad as my numbers were, which is why he was tolerating it for so long. But he's on thyroid stuff now, and it was also the T3 with him.
And, just so you guys who are watching and listening out there, you don't necessarily even have to have a family history, but I specifically ask my patients if there is a history of thyroid disease, because of course in any disease process, if there's any family history, you're just a little bit more susceptible to it. It doesn't mean, like, you've heard me talk about diabetes, and if you have a family history of diabetes, that does not mean that you are going to get diabetes, but you're just more susceptible or more prone to getting it. So you just have to be more aware and more careful. So the same thing with the thyroid. So again, like, some risk factors include, Hollis talked about family history. Another big one is other autoimmune diseases, and we'll touch on this a little bit, that with the thyroid, you can either just have, straight hypothyroidism, your thyroid is just like, I'm going to do my own thing and not listen to the brain. Or you can have an autoimmune form. And for hypothyroidism, that's called Hashimoto's. And just so you know, as far as the treatment is exactly the same. But now people have just become so much more knowledgeable and informed about autoimmune diseases and inflammatory processes. And we know that once you have one autoimmune disease, you're just so much more prone to having a second one. So for example, diabetes type 1 is an autoimmune disease. Diseases like lupus, sarcoidosis, rheumatoid arthritis, or autoimmune diseases. So then you're more prone. So a lot of times, especially endocrinologists, will just go ahead, like anytime I have a new onset diabetic, I'm checking for a whole bunch of other stuff that's autoimmune, because the chances of them having that is so much higher. And then of course the adrenal, Hollis talked about the adrenal. So like adrenal insufficiency, stuff like that. You can have, unfortunately, like a double hitter. So of course, age also plays a role as patients get older. Now they're doing a little bit more research, and they're thinking about changing the level. Like, of course, for every hormone, we have a normal range. It's not just one number, but they found it as we get older, that number kind of fluctuates. So they're looking at kind of tweaking those numbers, that when you're older, that you're not necessarily treated. It's considered still within normal range, but it's just a little different, somebody who's younger. And then of course, if you've had any thyroid cancer or thyroid surgery in the past, so then we would call that secondary hypothyroidism. So one treatment when your thyroid is too active, or you have hyperthyroidism, one option is to have your thyroid removed. A lot of times, if possible, the surgeon will leave a portion of your thyroid in there so it can make a little bit thyroid hormone, but most of the times it's not sufficient enough. So people will end up having to be on medication and having to replace that. And lastly, we don't see this a lot now, but back in the day, there used to be a lot of radiation treatment and things like that. Certain acne treatments that, again, were used back in the day. We don't use those anymore. It can increase your risk of that hypothyroidism. And then of course, there are medications. One specific one that we use for the heart is called amiodarone. A lot of times we use that for arrhythmias, and the cardiologist will always check your thyroid to keep track of that. So, if you're on that medication, just make sure either your primary care doctor or your heart doctor is just keeping an eye on that. So Hollis, so you guys probably heard Hollis mention the word supplements. And I personally, here at the Dr. Mom Show, I'm all about evidence-based medicine, but I'm also about holistic medicine. My own personal belief is, again, just educating my patients and having that relationship with my patients, that we make a decision together in regards to treatment, where my patient is knowledgeable and makes the best decision that they feel is for themselves or their family. So that's why I bring in the holistic approach, because a lot of people don't necessarily want to be on medication. You know, I'm like, hey, that's all good, but if it's like to a point where you're going to die or something, that's a different situation. But just as long as they understand the potential of that. So again, just as long as people are informed. So tell us about your treatment journey. And you kind of like hit on it a little bit, that you initially started just with the T3 replacement, but you were sensitive to that treatment.
Yeah, so I because of my lovely other problems, you know, I'm allergic to anesthesia, for example. Like when I've had to have 8 surgeries in my life for various other things, and I can't, like, they have to give me like motion sickness patch, and they can't give me a lot. Like I've been awake during a lot of my surgeries because I am allergic to anesthesia. So
oh my goodness.
Yeah, I mean, I'm fine. I'm good. But my tolerance. But so that kind of thing happens a lot with me. And so I was on the organic thyroid replacement for T3 for years. And then I also was on, at the same time, because my vitamin levels were crazy low and all of that, I was on a B12 injection for yeah, gosh, I think, let me think, 2012 to, I want to say for 5 years, I was doing that stuff. So yeah, to 2017, thereabouts. And I just, you know, the B12 injections I stopped in 20, because I basically had a conversation with my doctor, because I was tired of poking myself with a needle once a week, and I was tired of paying for the injections. So I asked him, I said, hey,
understandably, you know, so both things.
Yep. And this is another example of what you said, is like, you know, doctors don't mind if you talk with them about things. I had a conversation with my nurse mother about, like, hey, you know, or what are the other options for this? And she said, well, honey, you know, talk to your doctor, but here are some other supplemental things you can take orally for B12 and other stuff. And so I had a conversation with him, and we had those options, and we did it. And he said, you know, take 2 a day for a little while, to, you know, and then, like, we'll see how it goes. And we kind of did the transition of it. And you know, he saw me back in a month just to test everything, and the oral supplement was working. So
awesome.
And so I'm still on my oral B complex supplement, and which is not just the 12. It's like 6, and it's a lot. I don't know. I told her I have all of my. Yes.
I know. If you're watching on the video, Hollis has all her supplements. If you're listening, just, you know, Hollis has all her supplements handy. That's what an awesome patient she is.
Well, yeah, I like to keep everything. This is the Thorn. So yeah, that's the one that I take for B, and that's got like 6 and 12 and a few other things in it, which is great. And that one has been working well. But yeah, then I just, after a little while, I started to feel tired again. I started to feel really dizzy again. I started to feel all of the things, even though I was being faithful about taking my meds every morning. And I wasn't, because as you know, Dr. D, that when you take a thyroid, you take it first thing in the morning with like a full glass of water, and then you don't eat anything for an hour. You just have water. And so my pattern was wake up, take my pill, drink a glass of water, and I would get ready and drive to work, and then I would eat breakfast at my desk, because that's how long, they know my commute and everything would be about an hour. So that's how I live my life. But it was it just wasn't working anymore. And so I talked to my doctor, and at first he increased my dosage. And we tried that for a few months. That didn't have anything to do. And frankly, his answer kept being to increase my dosage. And I wanted to stay with this doctor because he had done so much for me. But at the same time, I felt like he had kind of gotten lazy with me. So I found someone else.
Yeah.
And I went to see a new doctor who is also, like you and me, more holistically minded. Obviously prescriptions when necessary, but if possible to treat naturally, it's better. So and she ran me through the gamut of tests, because new doctor, you have to get all the tests done.
That's right. Yeah.
Yep. And she said, you're this and that with the thyroid and all of this. Your pituitary gland is in big trouble, and my body wasn't making any iodine. So I literally don't.
Like, seriously.
And so I'm on an iodine supplement too, and I eat a lot of seaweed and fish. But
and just so that is very rare in the United States. I mean, I will say, just because salt has iodine in it, we see that in a lot of other countries. Like, you see, if you ever see those pictures and patients have, or little kids or people have goiters, what we call goiters. And I mean, I have seen goiters in the United States, but it's very rare to be iodine deficient in the United States. So yeah, that's probably why you did get written up, Hollis.
Yeah.
So that's why you are medical journal publication, because that is rare.
That was another one. Yeah, that I had two previous to that, but and the reason I was iodine deficient, because I cook at home, and I was using sea salt, which is not iodized salt.
Yeah.
And I don't use a lot of sodium in my cooking because it's healthier. And so yeah, I simply wasn't getting enough iodine in my diet, period. And so my body wasn't even making it. So yeah, she got me on. She said, let's try this. She was like, you still have some of your prescription left, but what I want to do is I'm going to give you all these supplements. I want you to take them. And she gave me all the proper intervals, blah, blah, blah. And she said, let's try this for a month. And if after a month you don't feel any better, then we're going to go back to a dedicated thyroid replacement, but let's see what happens. And which, I mean, you have to do sometimes, because even as even as a doctor, like, everyone's different, everybody's different. You have to do a little trial and error sometimes, and as the patient, you have to be willing to work with the doctor in order to find your correct treatment. So, I worked with her, and it worked great.
Awesome.
I have been off of meds since 2018, and I love it. I love it. I'm on supplements now, which is honestly, with the amount of supplements I take, about the same cost for me. But
yeah.
That's, I've got insurance and all that other stuff. I'm okay. But I'm so used to paying for things medically that I'm fine. That's part of my budget. But it's helped me immensely. And like I was talking about bald spots and things like that, I don't get them anymore, especially as a woman. If you're getting a bald spot like right in front, that's a real bummer. So I don't have that issue. My eyebrows are all full. I don't have
my eyebrows. Alice is beautiful, and she's got beautiful eyebrows. So
yep.
If you don't mind me asking, what all are you taking? So you're taking the iodine, the B complex.
The B complex.
And then what else do you take?
The C iodine. I have my D3 complex, my bone supplement, because as you mentioned, I have Hashimoto's and a few other things. So I have that, and I have the Vital Nutrients, which is actually a prenatal vitamin, because I have my hereditary issues, my mother's side was nobility in Italy. So there are problems that came from some inbreeding in the past.
And if you don't know that, that's just back in the day. That's what they did. The villages were smaller, and yes, the nobility, you wanted to keep that royal bloodline. So it wasn't, I mean, that's just how it was. I mean, that was the culture. So yes,
yeah,
and it is what it is.
But it breeds problems with your
that
your
is
genes.
true.
Yeah,
There's an
and
increase of mutations and genetic issues when yes, when somebody related is with somebody who they're related
too closely related. Yeah, and that honestly, sorry, that was my, that was the past. It's been a couple generations since, but it is what it is. And then I'm at selenium. This one I have the astric garlic complex, and this is basically to keep my blood pressure down because my thyroid and my pituitary gland and everything and adrenal and all that not functioning properly really stresses your body out, and your blood pressure can go up. So I take that to keep my blood pressure from being in a bad place. I take let's see if I'm going to pronounce this correctly, zinc picolinate.
Yes.
Did I say that right?
That's right.
All right. And we already talked about the thorn and myointestinal powder, which supports healthy ovarian function and hormones. Female, and again, this is a lot of pregnant ladies take this. I'm on a lot of because of hormonal issues that I have with my reproductive system and with my thyroid and pituitary and all that. It's I'm on a lot of pregnant vitamins.
Well, thank you. Thanks for sharing that. And again, just to reiterate, don't go out. If you have a thyroid issue, don't go out and all of a sudden buy everything Hollis is on. That's not why I asked her to tell us that. I just wanted her to share. So, if you hear any of those names again, at least it'll be something that you're like, hey, I heard this before. And to reiterate, like she said, everybody's just so different. So again, as far as the treatment, we have medications where we can replace the T4 or the T3. We have medications where they're more either synthetic or brand made versus for example, they have nature thyroid or armor thyroid where they use pig thyroid. So that's considered more natural. Now, one thing I will say just with the more natural thyroid, because they're not, quote unquote, FDA approved. So when things are FDA approved, they have to be a certain percentage the same. So for example, when you take a bare aspirin, that once it says X milligrams, that's what you're getting, and that's what FDA approved is. That's why it goes through that process. So when something isn't FDA approved, so for example, some supplements, what happens is because it doesn't go through that process, it may only have one bottle may have 60% of the medicine, one may have 70%. So what I tell my patients who prefer more natural or supplements, I just tell them, just make sure you're compliant with checking your labs. So we know that, your labs are all good. And most people, like Hollis mentioned, most people come back to me and say, I feel it. I know my thyroid's off. I mean, I will say at least 90% of my thyroid patients can tell when something is off. And I did just want to speak to, Hollis mentioned it, about just how sensitive when you take thyroid hormone is. So the reason why she brought up that she took it in the morning on an empty stomach, couldn't eat or drink anything else for an hour, is because the thyroid loves to bind to other minerals in our body. So that's why we say a sip of water, no orange juice, because the calcium and things like that, it'll bind to. If you eat, it'll bind to whatever minerals or elements that are in your food. And when I say that, I'm talking about potassium, magnesium, things that we eat. If you eat a banana, there's potassium in banana. So if you ate a banana with your thyroid medicine, it'll bind to it. So for example, if you're on 100 micrograms of Synthroid or a thyroid replacement, you may only get 75 micrograms that day because some of it became bound to the banana or the potassium when you ate it. So that's why it's so important. I always reiterate, like if people come back and their numbers are off, I'm like, are you taking it on its own? Because it's surprising how many people, I think also, sometimes as physicians, some physicians forget, like if I have somebody who comes to me and they're on medicine and their labs are off, that's the first question I ask them. Because the other thing is when we replace thyroid, we want to make sure you don't start going too high, because like I mentioned before, with hyperthyroidism, there's a whole other list of stuff that comes with that too. So we really want to find that sweet medium, or as we call it, euthyroid. We want you to be euthyroid, where everything is like equal. And I did just want to speak to, Hollis mentioned the fatigue and just her deficiency in vitamin D and B12. And that's huge. Like anybody who comes with fatigue, for me, especially if it's a woman who does still have menstrual cycles, you want to make sure your iron looks good, your B12 and vitamin D. I feel people forget about those, but you should get that checked if you're fatigued. By the way, B12 is pernicious anemia, which is autoimmune. So again, going back to just that relationship between these autoimmune diseases, and then of course getting the thyroid checked. And of course, if like anything else is going on, if people have like a family history of autoimmune disorders and they're having a lot of fatigue, of course, if people have a history of like tick bites, we got to think Lyme disease. If people have been out, I mean, there's so many other things. Hollis, it's like, obviously Hollis is going to be on this show more than once. So I hope you are enjoying Hollis, because she's like fulfilling at least a couple other topics that I'll cover at some point this year. So,
I'd love to know that. I've got a lot. And my dad suffered with Lyme disease for over 30 years.
Oh my goodness.
Yeah.
Oh my. Yeah. So be careful when you camp and all that, because those ticks, they'll get you. And that Lyme disease, a lot of times will show up afterwards. It's not something that you think about. It doesn't happen very abruptly or acutely after a tick bite. And then of course with Lyme disease, now we're finding it's associated with what we call chronic fatigue syndrome, where there's just like this long, potentially lifetime of just like chronic fatigue, something like almost like fibromyalgia, where your blood work looks perfect, your thyroid, everything is checking out nicely. And then all of a sudden, everything's been ruled out. So just look at all these nuggets you guys are getting here, not only about the thyroid, but because Hollis has got so much going on.
Yep. I'm a medical anomaly. Hello.
Well, I love it. Well, we're going to switch gears now. We're going to talk about Hollis's book. And again, that's called To Save a World, which is a fantasy book. Oh, yeah, there it is. So beautiful. I love the colors on the cover.
Thank you. I designed it.
Oh, I love it. See, she's artsy. See, I told you she was creative. So she puts it as if you love Dungeons and Dragons, that you would be into this book. So again, it's for any age. So we know younger people are into it. Even older people are into it. And then of course, personally, I've never even like done Dungeons and Dragons. So, but I do love Lord of the Rings. I love it. Epic. I have it on DVD. Love it, love it, love it. So I know I love this story that she's going to tell us a little bit about, and how we can get our copy of To Save a World.
Well, as mentioned, it's a fantasy adventure book. It also has a romantic subplot, because I am a sucker for all that. Yeah, that's right.
Yes.
I don't have a little of it. It's super fun. And, but basically, it's a story. It starts off the main character. There are 4 main characters essentially, but the first one is Ethne, who is this elf maiden. And she lives in her little village and has, her dreams and stuff. But she feels like a bird in a gilded cage. She just, she loves her family and all that. But the societal pressures and the societal limitations on women in particular in her society, she's not okay with it. She wants to do things the men can do, but she by law is not allowed to do. And all of this sort of thing. And so she tries to leave. And there is, but also the world it's a post-apocalyptic fantasy world. So years before, the gods, polytheistic fantasy world situation, they had a heavenly war and they killed each other off.
Oh, that's not a good situation.
No, the world has zero governance. Like nature is completely gone. Like the mountain ranges can pop up overnight. There, it's snowing, 2 feet of snow and blistering cold one morning, and then that afternoon it is just summertime heat to the extreme. It's like the weather makes no sense, and all of that.
I feel like this needs to be a movie. Just saying, if a producer or anything listening out there, I think this would be a great movie.
I have already, very nerdily come up with my dream cast already, so I'm set. If can
I be an elf? I love to be a little elf.
You can be an elf. You know what? Jocelyn would work for you actually, but she's like she presents as an elf, but she's actually a demon.
Oh god!
Well, they're a different race in this book. You have elves, humans, demons, and demons are just another race. And she's actually like super bubbly and super happy and cute, and she's got purple hair. Yeah. So you're very bubbly and everything. I could definitely see you as a Jocelyn. She's a little happy thing. But so Ethne, in this post-apocalyptic world, another person, Darian, one of the other 4 mains, he is a captain of the guard, and he basically is putting together this mission to go find an artifact to like a legendary magical artifact to help save his people. He's not thinking about the world in this. He's like, the crops are failing, people are dying, there's disease. If I can find this thing, then maybe I can use it to get this, our community to a better place. And so she tries to join up the mission by disguising herself as a boy. He sees right through that. He knows who she is. And then he tells her no, and then she just straight up follows them out. She runs away from home, and then it kind of goes on, and he decides to take care of her, because he's just like, you don't know what you're doing, and da 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 da. And I respect your family too much to let you be out here alone. And she was like, well, I'm not going back. And he's like, okay, fine. So it's this whole situation, and they end up running into Aram, who is another elf who's nomadic. You'll find out why he's an outcast. Not late in the book, like early in the book, you find out why he's an outcast, but I'm not spoiling anything for you.
Yeah, no spoilers.
No spoilers. He's an elf, and Jocelyn, who is the she-demon who was actually raised by elves, and she looks more elf-like, and that kind of thing. And they are all looking for the same artifact. And through that, they find out that they come in contact with this other character, the wizard Tim, which is a nod to the Monty Python Quest for the Holy Grail film. and he, and they basically learn that they have a greir purpose in saving. Oh, sorry, my husband just walked by.
Oh, no worries.
There's not a strange person in my house.
I get visitors all the time. If you watch the show, the Tripsy's always. So we love visitors.
Yeah. But yes, just in case anyone's concerned, I know who that is.
She knows. I love it.
Yes, and so they basically with the wizard, he lets them know that they are destined for more and that they need to save the world essentially. Yeah. And then the book goes on a different trajectory, and they are still kind of half looking for that magical artifact, but they also are going through this bigger journey, and it's also for the 4 characters a journey of self-discovery as well. And that's something that a lot of people, particularly my older readers, and older meaning not the young adult crowd, like people who are 25 and up, who have mentioned to me, I've gotten a lot of happy feedback where they've said, you really approach a lot about sexism, a lot about, gender inequality and equality, prejudicial, racism, bigotry. Like they're like, you approach a lot of this through each of the characters' personal journeys. And I was flattered. I was so flattered and a little surprised, because I was just writing a cool story with cool characters, and I didn't realize that I was doing that, and kind of projecting myself, my inner thought process into it, until I got the feedback, and people were like, "Yeah, when this character had to relate about this situation." And I have a cat.
Kitty cat.
Yes. Sorry.
Oh, you're okay. It's okay.
It's anyway, so he so that's it basically, through my distraction.
Awesome. Well, that sounds amazing. And of course, Hollis can't spoil you. She can't tell you the end, because you have to get your copy of her book, To Save a World. So Hollis, how can they get a copy of your Save a World?
So Amazon is the most readily available, easiest. It's available paperback and ebook. You can also get it on barnesandnoble.com, and I know there are other online retailers that sell it. And it's also on what authors call the Ingram list, meaning this worldwide list of books that bookstores order from. And so you can literally order it from any bookstore in the world if you want. If you'd rather just walk into your local bookstore and say, "I want this book, please," they can look it up on their computer and order it for you.
Awesome. See, so no excuses. You can get it anywhere. And then, of course, you guys can connect with Hollis. The easiest way to connect with her is via her website. It's up there, www.hollisjoemccollumauthor.com. I'll have those in the podcast notes so you guys can connect with Hollis, check out her website, check out what she does. Again, because she's an author, but even more awesome, she's a mentor to up-and-coming authors. So I love this so much, because I am a firm believer that everybody should at least write one book in their lifetime. And Hollis is the perfect example. She didn't even write a book about herself, but her personality and like her thoughts are like shining through her book right now. And I think it's so important, because when we write, we are leaving a legacy for the future, whether you have kids, grandkids, or just the people around you. It's just an amazing way to impact others. So I love the fact that Hollis does also mentor. So make sure you connect, make sure you get a copy of her book. And look, it's even available as a Kindle version, so you can carry it anywhere with you. And again, that's called To Save a World. So, well, Hollis, it's truly been a pleasure to have you on the Dr. Mom Show. Thank you so much. And thank you for sharing your story. Yes. And I mean, I've enjoyed it, because, not only talking about your book, but also just your personal thyroid journey and everything else involved. Because again, I'm just saying it again, Hollis will be back. Hopefully she'll want to be back.
I'll want to come back. No, I'm happy to share. I'm very open about my medical things, because honestly, if you don't share, other people sometimes don't know if they have an issue. And,
that's right.
And and there's nothing wrong with me in a sense. I mean, yeah, I take supplements. There's stuff wrong with me physically, but there's nothing wrong with taking care of yourself. And
yes.
It's not a weakness. Be okay. Most of my friends and family say I'm super tough, and they want me in the apocalypse. So even with all these conditions.
I love it. She's got all of that, but she's got superhuman strength. I love it. So thank you again. And then, of course, thank you, viewers and listeners out there, for joining us today. Don't forget to subscribe and leave a review of the Dr. Mom Show on Apple Podcasts or any other of the podcast platforms like iHeart Radio or Spotify. And also follow the Dr. Mom Show on Facebook at Dr. Mom_show. And if you're a Facebook fanatic instead, you can also check out the Dr. Mom Show page and like us there. If you prefer video, we lost Hollis for a minute. But oh, there she is. All right.
I just
So you can check out the Dr. Mom Show on YouTube. Don't forget to subscribe to the channel. And of course, stay up to date with everything that I am doing. Dr. D, Mom of Three, at www.drdelenemushalak.com. And again, just to reflect on writing your own book, I would love for you to publish your book with Alea Publishing. We definitely do a personal touch, making your vision into legacy. So if you're thinking about writing a book, again, if you're looking for a mentor, reach out to Hollis or even to our company. We will help you out. And just a reminder, make sure on the Dr. Mom Show, there's freebies out there. We're in a new year. There's some awesome workshops that are going on about clean eating, detoxing. So if you're into it, we got some special rates going. So definitely check that out. And don't let 2021 pass you without you making some improvements in yourself. And of course, remember that life is precious and priceless. You are amazing, and you can do anything you put your mind to because you are a superhero. Just have faith over fear, and God bless. And of course, don't forget to wash your hands, kiss your kids, love your families, and say your prayers good night. Thank you so much, Hollis, and thank you, everybody. Love you.